go.
You're gonna feel something real cold.
Yeah, you're gonna get a little cold spray here, and then you're gonna feel
cold.
a little sting, sting, and a burn. Ooh, that's cool. Brr. You ready?
I'm ready.
Okay, that's good. All right, a little stick, sting, and a burn. You really froze that skin. Kristen really.
Is it real cold?
Very cold. Now, are you feeling a little sting?
I feel a little sting.
Okay, that means it's working, right? So the medicine's infiltrating,
Okay.
and that's what we want. So this is actually deep. It goes deep. So this is going to be one that goes pretty deep, and so we want to be sure we really do a good job of getting plenty of anesthesia on board here.
I'm sure it has a root. And
Maybe.
Sometimes I felt like it was growing down my
Right?
spine.
Or a core, right?
A core.
Feels like a
something.
core.
Yeah.
Yeah. It's going in. There we go. Okay. Yeah. It's getting there, getting there. So we're going to use plenty here so we can be sure that we have adequate anesthesia on board, and then we don't feel any sharp pain. Now you'll feel some pushing, you'll feel a little bit of tugging, that kind of thing.
Okay.
But it shouldn't be any kind of sharp pain beyond what you're feeling right now. Right?
Okay. I'm a big girl. I survived COVID.
Well, I heard it was over, but I'm a bit skeptical.
I am too.
Did you hear that announcement yesterday?
I heard it.
I don't believe it. I don't think we're quite there. I mean,
I don't
sure,
need the
we've made
doctor.
progress, right? But I mean...
Well, they're just now
Yeah.
able to decipher what it is that they've seen
Right.
and getting all the information and gathering the information and
Got a little blackhead there, but no big deal. So, yeah, okay. Good. We have Jenny on the camera. We have Kristen doing the assistant.
okay.
All right. And Sparrow J. You do have a little punctum there. See that? It's pretty easy to see.
Yes.
All right, we're making the incision. Are you ready?
I'm ready.
No, fantastic.
What weights are you using, Doc?
There. What did you get me? A 15?
15.
15, yeah. Kristen just gets to pick whatever she thinks is right.
Thank you, Kristen.
Pretty easy
Yeah.
going. All right. Well, we're definitely down to the cyst already. It did not take very long.
Very good.
Okay,
Okay, I'm ready.
Oh, I don't know if we're going to have that kind of an eruption, Jenny. But you never know, right? I'll let hemostat here and get in there and open that up. Okay, good. Not yet. Yeah, no, just another 4x4. Okay. So it's what, the 19th of September? Oh yeah. See, this has drained before, so we're gonna have to definitely get in there and get that sac out of there, because most of the stuff in there, right? Most of the mucin, the oils, and the proteins they've already all come out, but we're gonna push on there, because emptying the sac first makes it easier to get everything out. You feel me pushing back here?
I feel a little pushing,
little
but
pressure?
it's okay.
Yeah, okay.
I don't know why Doc said that this might not be a good one, but look at that.
So there's more. Yes, I will need the forceps now. There we go.
So if it is drained, has it drained back into my body with those?
Well, that's a great question. I think that it drained maybe outward a little bit, and maybe it was a small amount at a time, and it wasn't easy to recognize. But it's definitely drained, and it goes real deep. Look at that, Jen.
Yeah,
See,
yeah.
it goes way in there. So this goes very, very deep. We're gonna need some more anesthetic.
How much more you want?
Another
About the
3
same
C's, yeah, or about the same amount, yes. So we're going to have to widen this excision a little bit. Incision a little bit. We're going to have to widen it a bit because this goes so deep. We're going to have to
Yeah.
make the incision wider to get to the bottom, and we definitely want to get to the bottom. Okay.
Yeah.
All right. Let's take a quick
little
pause.
break.
Yes.
So it's been
All right. So adding a little more numbing here because we are going to widen this incision a bit.
okay.
Because it's deep. Oh, that was for the camera, Sparrow J. Yes, that's why I said that. I thought I I thought we talked about it already, but you never know. And this is absolutely a suitable, look at that coming
All right.
office procedure. This doesn't have to be done in the operating room. It's just not that big.
Good.
Local anesthesia applied liberally is very effective. Yeah, look at that. So again, we're just removing the trapped
Oh, yes.
material that's in there. Well, got more coming out now.
Uh-huh.
Sparrow J, you'd be so proud. There we go.
What causes that, Doc?
Well, it's a way to think about it is that it's sort of an oil gland that's gotten blocked a long time ago, years ago, and as a result, it continues to secrete the oils and proteins that we normally find on our skin. However, it can't escape, right? So it begins to just build up, and
Okay.
it forms a cyst-like structure,
Okay.
right? And that's what we're doing now.
And I probably irritated it 2 or 3 times, maybe thinking it was just a pimple. that needed-
Sure.
Or a blackhead.
Right, because you feel something back there and you say, I
Right.
got to get that out of there, whatever it is. Right? Okay. So these usually are interesting. Now this has definitely been around a while, Sparrow J, I can tell you that now, because as I grab onto it, it's not releasing easily. It's fighting back, right? And the reason it's doing that is because it has gotten irritated before, just like you're saying, and we're getting a little scar tissue in there, and so that makes it a little more difficult to get to the bottom. Right, but we will. Look at that right there, Jenny.
This is
Interesting.
the roots.
Yeah, it's like the root.
Core.
Yeah, the root. That's what we're headed for now. Get that right there. We got a little of that over here too.
I see.
It kind of goes a little bit superior. Yeah. Okay, so we're going to use a cotton tipped applicator to get in there and kind of make sure that there's nothing remaining.
On the scar tissue, what causes the scar tissue? From the cyst?
Right. So not directly the cyst, but the inflammation that has surrounded the
okay.
cyst and the draining. So we've got it all, Jenny.
Right.
We are. Sparrow J, I do not see any cystic saccular material left at all. That looks great. So, do we have any flush? Let's pause for a second so we get some flush.
Go.
All right, so we've got a little flush there. And we're going to apply a little flush here, a little squirt right in there. Let's see if anything in there bubbles, and we got it. So we're good. And Miss Jenny, can you get a good look in there?
Yes, sir.
Yeah.
Very good.
I don't see any cyst left at all. I just see a little fat, and I see a little scar tissue right there. Let me just check one more thing with that hemostat, please, ma'am. Yeah. Gotta make sure. Yeah, that's just a little piece of scar. And that's good, though. It's clear around it. That right there is just some connective tissues. All right, so when it's deep like that, it's just a little more challenging, but we got it. We're ready for a suture. I don't think we really have to record the sutures, but you can. It's no big deal.
Your suture work is so wonderful. Right?
Well, you're too kind. Thank you. Yeah.
He's a great, great doctor.
Well, you're very sweet to say that. And you're a great bird. Yeah. I have lots and lots of patients that I love, but I gotta tell you, Sparrow J here takes it up an extra notch. She really does. You really do. You're a sweetheart. I've always enjoyed seeing you. All right, let's do another little snip there. And we heal. This is all going to look great, and it's laying down nice and flat. Not puckering. I thought it was going to pucker, but it did not, so that's good. And we're going to put a dressing on this for you in just a moment. Thank you so much for sharing your epidermoid cyst with people that like to watch. Okay?
You're more than welcome,
All right.
Doctor.
Thank
you.
you.
God.
Thank you so much.
You're welcome.
Hey folks, you spoke and we listened. Here's what you had to say about Meta 7.
I love it so much. It gives me so much energy during the day.
I've noticed a change in my hair, my nails, my blood pressure.
There's no doubt that it's a benefit to me. It gives me more stamina.
And it can actually help you lose weight.
Now, I haven't taken a nap in 6 months.
That's right, Meta 7. More and more people are sending in their testimonials. Weight loss, more energy, and generally feeling more alert during the day. Let's hear more.
I used it to help wean myself off caffeine and energy drinks, and my productivity has been very high lately.
It's natural, it's amazing. I feel motivated to get out and do things that I didn't before.
I'm not tired during the day. I've worked 12-hour shifts.
Just go all day. It makes me feel great. I love it, and take it. It's wonderful stuff.
If you haven't tried Meta 7 yet, it's time to order yours from Amazon. Time to boost your metabolism and kick your energy level into high gear. There's an Amazon link in the description.